Hello everybody, I'm going to be demonstrating the ABORh procedure that you can find on page 7 in your student lab manual. Please excuse any noises, I am in the lab right now working. So if you turn to page 7, you'll want to keep that next to you and follow along while you're doing your procedure. In case you have any questions, you can follow along while I'm doing this video. On page 18, you will find this worksheet right here. This is where you're going to record your reactions, and as it says in your procedure, make sure you record any reactions before you start on a new tube. You want to record those right as you see them. So today we're going to be working with this sample, Z-Test Ladybug. That is going to be who we're working with today. So the first thing we're going to do, according to our procedure, is we're going to label 2 tubes with the patient's full last name, first initial, and medical record number. So the full last name, Z-Test L, and the medical record number according to the tube is 103695552. So 103695552. And make sure that you can read that as well, make sure it's legible. So those are our first 2 tubes. The next thing I'm going to do is I'm going to go ahead and record my patient's name on the sheet so that I have a place to record my reactions. So the patient name is Z-Test Ladybug. Her ID number, again from the tube, 103695552. Okay, so we're gonna do this tube ABO first. So from our procedure, we're gonna take our tube, the clean pipette. We're gonna take some of the plasma. I'm sorry, we're using an EDTA tube today, so it's plasma. And we're gonna put some plasma in one of these labeled tubes. In the other labeled tube, we're gonna put 3 to 5 drops of red cells. So 1, 2, that's about good. You don't really have to count your drops, just make sure you get around 3 to 5. Okay, so then I'm gonna throw that away. And then if you look on page 8 of your manual, you'll see how your tubes should be set up in the rack. So you're gonna have your patient's red cells here. You're gonna have 3 other tubes, a space, your patient plasma, and then your 2 back types. So let's label our front types. So our front types, according to our procedure, are gonna be labeled with the patient's initials and the identity of the reagent. So the patient's initials are gonna be ZL. Our first reagent is going to be A. Our second reagent is going to be B. And our third reagent is going to be D. We'll put those right here. Okay. For our back type, we're going to have ZL. And we're going to put A1 for our first reagent, ZL, and BC, which means B cells, for our second reagent. Now we are going to go ahead and make our 3 to 5% solution. So we have our 3 to 5 red cells in our labeled tube. Make sure you don't touch the tip of the saline to the tube. You don't want to contaminate the saline. You'll put a little bit in there. You're gonna make sure that the cells are, you can shake it around a little bit, make sure the cells are all in solution. Okay, I'll show you what a 3 to 5% solution looks like in a pipette. So this is going to be your 3 to 5% solution, right? It's going to look like this. Okay, and this is a clean pipette. Okay, so whenever you're doing an ABO, you want to make sure you add your reagents and your plasma or serum first, because once you add your red cells to that, it's hard to tell if you've added your reagent. So our first tube is our A. We're going to use our anti-A reagent. You want to add 1 drop. Our second tube is B. We're going to add our anti-B reagent, 1 drop. Our third tube is D, so we're going to add our anti-D reagent, 1 drop. At that point, we need to move on to our back type. Since our back type is our patient plasma, we're going to add 2 drops of patient plasma to each of these back type tubes. You grab a clean pipette, and make sure you see how this is a pipette with measurements on it. This is a special blood bank pipette. It drops that are a specific volume. So you want to use a blood bank pipette and not just any transfer pipette. So you want to do 2 drops of the patient's plasma in each of the back type tubes. Okay. At this time, you can go through and make sure you've added all your serum or your reagents. So you can see we have our serum in there. We have our blue A, our yellow B, and our clear D. Okay. So now we can add our red cells. Our front type, we're going to use our 5 to 7% patient red cells. We're going to add 1 drop to all the 3 front type tubes. Okay. Our back type, our A1 tube, we're going to use A1 reverse cells. Now whenever you pick them up, they're going to be on the bottom of the vial. You want to just gently swirl them and shake them kind of like this, gently, to make sure you get all the red cells off the bottom of the vial. Once you do that, you can pick up and you can add 1 drop of these to your back type, your A tube. The same thing with our back type B cells. You get your B cells and you're going to want to mix them to make sure there's nothing on the bottom. Okay, like that. Now you can add 1 drop to your B cell back type. Okay, so then we're going to take these and we're going to spin them in our centrifuge for 15 to 20 seconds. It should stay on your centrifuge what it's calibrated to. Mine is going to be a 15-second spin. So you want to make sure you balance your tubes. I personally always add an extra empty tube. So I have 6 tubes. I do 2, 2, and 2. So let's go ahead and spin that. Once it comes out of the centrifuge, we're going to record our reactions. You can see we have the forward type with the D and the reverse type. If we do have a D negative, we will do a weak D test. So I'll show you that if we have to do that. Any of your D negative results, you're going to have to do a weak D according to our procedure. That's not always what your clinical site will do, and most often they don't do a weak D on everyone. But to get the experience, that's what we're going to do in a student lab. Okay, so our centrifuge is done. You want to pull out the tubes one at a time and read them one at a time. So your first tube, you can use a light and a magnifier if needed. You want to read it against a white background to make sure you're seeing. So this reaction that I see here, this is a negative reaction. So we're going to put that down and we're going to record 0 on our anti-A. We'll pull out our anti-B. Again, you want a white background. You want to watch the cells come off. Make sure there's no microclots or anything that's going to be a 1+. This is also a negative reaction. So you want to record that on the anti-B. Next will be the anti-D. Again, this is a negative reaction, so we'll put a 0 there. Since our D was negative, we'll have to do a weak D, and I will show you that next. Let's go ahead and look at our back type. So our front type looks like an O. Our back type, we're going to check for that. So let's look at our A1 cells against a white background. All right, that is a 4+ reaction right there. 4+. And then our B cells against a white background, that is also a 4+ reaction. So we'll record that as 4+. Now we cannot do our interpretation until we do our weak D, so that's what I'm going to show you next, a weak D test.